Welcome to another Medicare Mamba segment brought to you by ACV TV, 3M Studios, and Custom Care Solutions. Hello, I'm Lisa Ford. Join Brian Bilhartz and I as we discuss all things Medicare. There's several different parts to Medicare, and it really is super confusing. My 40 years of healthcare, I see all the Medicare patients coming in all the different areas that I have worked in throughout my career, but all these different parts. There's several different parts. Can you talk to us a little bit about those parts?
Yeah, there's actually 4 parts.
Okay.
And again, because we're talking about a federal program, it can get confusing with parts and plans. And we'll talk about plans, another time.
Okay.
But whenever it's referenced parts, that means Medicare, like at its foundational core, Medicare.
Okay.
So when you receive your Medicare card, it's typically going to have Part A, Part B, and then there's a Part D that we'll talk about, and then there's also a Part C.
Okay.
So your Part A is typically your inpatient coverage. If you're in an inpatient setting, whether it's inpatient hospital, if you're in skilled nursing, even if you're in a hospice facility, those facility charges will be covered under Medicare Part A.
Okay.
Yeah. So there's deductibles and things that could apply depending on what the situation is. There's so many variables that play into that. But for most people, Part A doesn't cost a premium. As long as you or a spouse, it could be a current spouse, it could be a previous spouse, worked 40 quarters paying your FICA taxes, your Medicare and Social Security taxes, as long as you have they call it 40 quarters, which is 10 years, as long as you have that 10-year work history, Part A comes at no premium.
And does that matter where the 10 years play? Like maybe I worked 5 years before my children were born, took some time off, and then I worked another. So it doesn't matter where that 10 years
No,
falls.
just an accumulated amount.
Oh, that's
and
wonderful.
again,
Okay.
even if maybe you've been a homemaker your whole adult life and don't have those working credits, well, as long as you were married for a minimum 10 years, and then that spouse, whether it's current or previous spouse, obviously they had to pay as well, but they have to be at least age 62. You could collect off of their Medicare benefits, even though you haven't accumulated your own.
Okay, so that's Part A.
Correct.
Okay, let's talk a little bit about Part B.
Yeah, so Part B is really for outpatient care. So your doctor visits, lab, x-rays, anytime healthcare is really being administered to you, that's typically going to fall under Medicare Part B.
Okay.
So Part B, there's no, taxes that you have to pay to be eligible for Part B. But Part B does have a premium associated with it. The standard Part B premium right now is $185 a month. It could be more based on your income, actually.
Oh, okay.
From previous 2 years, and that's a whole other topic we could get into.
Exactly. Thanks for watching Medicare Mamba, and don't forget, like and subscribe. Please share this with anyone interested in this valuable Medicare information. Until next time, I'm Lisa Ford.